keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
I'm Bill Zogby from the Methodist DeBakey Heart Center in Houston, and with me today is Dr. Allen Klein from the Cleveland Clinic. Alan, it's good to have you here. And you have a study in JACC imaging on the importance of right atrial volume in predicting prognosis in patients with heart failure. Why do you think that would be important?
Well, first of all, Bill, it's a pleasure being here. And the left atrial volume index has been thought to be the hemoglobin A1C of people with diastolic heart failure. So we looked at the right side of the heart as a marker of RV function. The worse RV, the worse the prognosis. The right atrium is a very simple measure of the dilatation of the right atrium, and it could be a very good predictor.
So what did you find in that study that you did?
So what we did is we took a population from a previous study called the ADEPT population. That's assessment of Doppler and evaluation and prognosis of heart failure patients, 192 patients, and we measured the right atrium. We measured the right atrial volume using Simpson's method, single plane method, and we found that the size of the right atrium predicted outcome in these type patients, these heart failure patients.
So how does it compare, let's say, with other diastolic heart failure measurements like tissue Doppler or tricuspid inflow?
As part of the project, we measured RV systolic function. We rated it 0 to 5. We measured stage of diastolic function, 0 to 3, different stages. We measured tissue Doppler of the annulus, and we found that the right atrial volume index correlated best with RV systolic dysfunction. It did correlate with RV diastolic dysfunction, but interestingly, it didn't correlate that well with the instantaneous E over E prime of tissue Doppler.
So basically, you feel that the message to the cardiologist and people involved with heart disease that it is not only the importance of looking at left ventricular function, left atrial size, right ventricular size and function, but also the right atrium is also important in that sequence of events and tells you about severity of disease.
Exactly. So the right atrium is sort of the last stage. The bigger the right atrium, you already know that the LV systolic function is impaired and has a very good predictor. It's more predictive than BNP, tissue Doppler, and a tricuspid E/E ratio. So it's a new, simple measure, so-called the right-sided hemoglobin A1C of heart failure.
So keep in mind the right atrial size and volume when you evaluate patients with left ventricular systolic dysfunction. Thank you very much, Alan,
My pleasure.
for being with us.